Good morning. And I'm going to say it again. Happy New Year, because we're still in the month of January and it's still a new year. Welcome to the Great Lakes Health Radio program on Power 96.5 FM and 1080 AM WUFO. I'm your host, Francesca Messiah from Kaleida Health, and hope this year will be a good one for you, your family, and our community, because we know we are still healing from, gosh, the tragedy at Thompson, just so many other things, and the snowstorm. And we just have a lot of tragedies, but we have a lot to be thankful for. Thank you for listening to our radio program, again, that impacts the health, that impacts the lives of our community. Who is Kaleida Health? Kaleida Health, we are the hospitals. We are home care. We come to your home with the Visiting Nursing Association, 24 hours a day, 7 days a week, regardless of age. We have two nursing homes, one in Tonawanda, North Tonawanda, and the other one right here in Buffalo. They're both qualified, and they're excellent facilities to send your loved ones. I talked about the hospitals. Who are the hospitals? We're Buffalo General Medical Center. For adults, we're Oishei Children's Hospital. For children, we are Gates Vascular Institute, which takes care of needs of the heart, the stroke, vascular. It's where all of our physicians come together. And all of our physicians come together at all of our hospitals, but especially at Gates Vascular Institute. We're Millard Fillmore Suburban, and we're also DeGraff Medical Park, again, in North Tonawanda. Also, Kaleida Health has several clinics throughout Western New York for adults, for women, and children. And I can't leave out our newest affiliate, which is a Great Lakes Health Cancer Care Collaborative, which takes care of all cancer needs, from screening to we have oncologists, we do the surgery, we have support groups following your cancer surgery, and during your treatment, we have chemotherapy, we have social workers. And please, if you have any questions about Great Lakes Health Cancer Care Collaborative, for now, I'm going to give you this phone number to call, and that is 716-863-8717. Again, that is 716-863-8717. And from there, we'll be sure to direct you to the proper department. And that goes for any of our services, again, at Kaleida Health. Did you know Kaleida Health is hiring? We are hiring for all positions. Because we're a hospital system, we have positions that are open, not all, but several that are open 24 hours a day, 7 days a week. And I want to thank all of our staff just for doing such a great job at Kaleida Health. Woohoo! Well, our guest for today is not a stranger to the show. Our guest for today is Sherry Curry. Good morning, Sherry. How are you?
Good morning, friend. I'm well.
And Sherry Curry is a manager of family planning. And today's topic, we've had family planning on before, but today's topic, we're talking about facts about family planning and the importance to family planning in our community. So Sherry, let's get started. I've known you for, gosh, I would say at least my 17 years at Kaleida, and I've watched you rise through the ranks, because Kaleida really does enjoy promoting from within. And when family planning began, what are some of why is family planning such an important component within Kaleida Health?
Good question. And honestly, I would say because we are the community, we represent the community. We're here as a staple in the community. Our department has been in existence for over 50 years as part of Kaleida Health. And we are offering, confidential, comprehensive reproductive health services to both the men and women of childbearing age in Erie County.
And Sherry, I just want to also add there, you said 50 years. Kaleida Health isn't 50 years old. However,
no, it isn't.
and so where did family planning begin?
Actually, we used to be Deaconess Family Planning, and we housed a location at 590 Riley, which was at Riley and Humboldt Parkway. And then as we expanded and grew, we had some space over 1001 Humboldt Parkway, which was the Deaconess, no longer hospital, but then skilled nursing facility. And as we continue to grow and expand, and that facility was going to be transitioned out into the new building, which is High Point. We moved out of that location, still on Riley, but Main and Riley. And we've been through every change that Kaleida has morphed into, from Buffalo General to CGF to, all the various names.
Well, you are, the department is a survivor. And has family planning always been located on the east side?
Yes, it has. And also we did, fortunately, in past years, had a location on the west side, several locations actually, where we were at Matina. We were at Grant Street one time. We also shared some space within Evergreen, at one point, and we were out in the South Towns. We were in Akron. So we were kind of, diverse and trying to provide the needed services in, all facets of the, city, rural, and, like I said, east and west side of the Buffalo.
That's great. And I have to say that you've been working for family planning for many years, and that you did replace Lori Gilbert. Yes. Mm-hmm. Okay. So in case anyone was familiar with family planning and wondering what happened to Lori, well, Lori retired and she's doing well.
Yes, she is.
in Buffalo. So Kate, you talked about services are available for men and women.
Yes.
Around what age, and if you could please discuss the services provided by family planning. And where is it located? And where are you located? Sorry.
Okay. So to start with location, we're located at 1313 Main Street, which is on the corner of Main and Riley. And the services we provide are reproductive health services towards prevention, intervention, educating men and women of childbearing age about, sexually transmitted infections. That includes HIV. Staying healthy, staying on top of, for women, mammograms for men, TSC, PSA, kind of things, and just understanding their reproductive health and not taking it for granted. So that can start with, pre-adolescence all the way up into, a person, a young woman, going through menopause. So quite a bit of our patients been with us since they've been teenagers and still come to us, or their children come to us, their grandchildren, because that's how we've been able to stay viable for this long, by word of mouth.
That is great. And for those who are listening and you're thinking, Main and Riley, I see a building, I see, a car rental place, and I see a building that looks like someone's house.
Yes.
And that's family planning. That's family planning that looks like someone's, like a former Buffalonian's home.
Mansion. Yeah.
Mansion. It looks like a mansion, and there's free parking in the back, right?
Absolutely. Yes.
Yes. Okay. I just want, and masks are still required inside of the building.
Yes.
Which is all part of the hospital system, and also keeping germs down, and for your safety, our safety, I should say. Now you mentioned for young men and women, what if someone has gone through menopause? Can they receive services, or would you refer them to another Kaleida site?
If they're an existing patient, we would continue to see them, because we know, regardless of your options to be able to reproduce, if you are, sexually transmitted infections and HIV has no age, cutoff. So current patients who are menopausal would, if a new patient would come to us, we would then need to refer them out. We also don't do prenatal care. So if a patient comes to us and they say, well, I want a pregnancy test to confirm, or, a pregnancy and they are pregnant. So we do refer out for prenatal care.
Refer out meaning you refer them to where?
We refer them within the system to, it's at the discretion of the patient, but, we do have the women's health programs, Niagara. We also have within Oshai. So we do refer within. But again, it's at the discretion of the patient.
Yeah. And we also have the women's site over on the campus of ECMC. It's not inside the building, but it's freestanding, and the bus stops right in front of it.
Absolutely.
And as well as Niagara, the bus stops right in front. Just want to mention that. So if and I know everyone doesn't know the terms, but if say you are, I don't know, 18 years old and you're a sexually active male or you're a sexually active female, is this the kind of place you would come if you have any questions? Is this where you would come to family planning?
Absolutely. We have a nurse practitioner on staff as well, a medical director who counsel the patients, have opportunities to discuss and talk to them about, preconception, for people who say, right now I may not be interested or have the desire to be a parent at this point in time, but what can I do to make sure I don't have issues as it relates to infertility later on down my reproductive lifespan? And they can educate them and talk to them about that. We will have an educator, a community educator who goes out into the community, does outreach, participate in community health events, and go into the schools. That's Buffalo Public and charter schools and other community-based organizations to talk about our services, talk about what we offer, and explain to someone, as you stated, 18, that teenagers in our facility, all the services we offer are free and confidential.
That's wonderful. And you also go into some of the community colleges, correct?
Yes, any college that would invite us in. I know a lot of times they have like career days, and that gives them an opportunity to see other aspects of health careers. Come in and speak to an educator and say, yes, I may be in education, but I want to incorporate that in the health setting. How do I do that? You could become a community educator. You could be someone who trains nurses or to that effect. So, yes, there's a lot of opportunity when you're talking to college students. And then also we do have a nurse practitioner who does testing on site at Damon College. So, there are opportunities for other colleges to have, our provider come in and do STI clinic testing. If that's something you want to do, we're more than willing and open to do that, because we want to provide our services where it's needed and to as many people who would benefit from it.
Speaking of that, how would they reach you?
Yes. So our office number is 716 area code 748-4988 is the main number for the clinic. And we're open Monday through Friday. Someone's here at 8:00 and until about 4:30.
How about speaking engagements? Do you or someone from your staff do speaking engagements?
Yes. Myself, no, not as much as like outside of your program, Fran, on Great Lakes Radio. But we do have a community educator who would be available to go out and do speaking engagements, do trainings, do other events, as needed or as requested by the community.
As requested, right? Correct. How about I know that, or I'm aware that family planning works along with Great Lakes Health Cancer Care Collaborative, as I mentioned in the opening, Great Lakes Health Cancer Care Collaborative, and I believe you work with HPV prevention. If you could share with us, what is HPV, what is HPV prevention, and why is it that you're working along with Great Lakes Health Cancer Care Collaborative?
Yes, well, HPV, just an acronym for human papillonal virus, which in layman terms would be, warts. And they are contracted through, sexual contact with an infected person. So just like with other sexually transmitted infections, how can we reduce the exposure? How can we educate people on what are the signs, what are the symptoms, what are the ways to prevent it? Because quite a bit of these sexually transmitted infections are 100% preventable. Not all of them are 100% curable. We can treat them all, but we can't make them all go away. So, the best way is to reduce those numbers is educating people, letting them know that yes, HIV is out there, yes, COVID is out there, but there's other things too that we can put ourselves at risk of coming in contact with, based on our behavior. It's all about behavior. It's not about who we are, where we live, what our income is, if we're insured or uninsured. It's about what we're doing. So if we educate the population and let them know that this is preventable, these are the signs and symptoms, this is how you prevent coming in contact with this, that will lessen the cause for it. So HPV, in my involvement, is primarily just providing information on, how many cases have we had, how are our patients informed, how are they educated, how are they referred out, how they get the information they need that's continually updated. And that's how I've been involved with the collaborative with Great Lakes and the cancer program.
Yeah, and your knowledge is so, you're just a wealth of knowledge. Can you also, or I should say, do you also give presentations on, or can you, if someone is interested again, on HPV prevention? Is that another talk that you can share if someone is interested?
Oh yeah, absolutely. And like I said, it would go in conjunction with other sexually transmitted infections, just as, they're all equally important when you have strains, and getting updates all the time from the health department, CDC, about syphilis and gonorrhea, to the point where those, again, preventable, treatable, and, infections are becoming resistant to the medications we have. And, we don't want, the public to be naive or not knowledgeable about the importance of those as well. But HPV, like I said, because it's a viral infection, can cause cancer growth in men and women when you're talking about the female anatomy and the male anatomy. And how do you reduce that? By educating.
Mm-hmm. And okay, so I'm going to have you give your phone number one more time if someone didn't write it down before, because they didn't think they were interested in tabling, but now they're interested in having a speaker come, such as yourself or one of your representatives, come and speak about HPV or sexually transmitted diseases. What's your phone number again?
Yes, the area code is 716, and the office number is 748-4988. And they can just ask to speak to the manager, or they can ask to speak to someone in the education unit and say, that's pretty much it. And just say, can I speak to someone there? And they would transfer the call in to the person or myself.
And then also, as people have told me, they said people don't call. They'd rather send an email. If you could provide us with your email address.
Well, we do also have a website that talks about
our services. Website.
Yes, we do. So it's yourbodyfirst.org.
One more time.
yourbodyfirst.org.
Thank you. Now you talk about how most the services are open. You talk about premenopausal and it's open to men. Now, is HPV, is that something that only affects younger men and younger women, or can HPV and or sexually transmitted diseases, can that affect adults at any age or just younger?
Any person at any age who is sexually active. So it, does not care about the age, does not care about, anything other than that. You have to look at it as it is. They're germs, bacteria, and viruses. They're looking for somewhere to take up residence. And if you don't want them in your body, how are you going to prevent that from happening? So.
Mm-hmm. How about literature? If someone is doing a project, let's say a project in school, and they need some materials because they just want to do further research on their let's say high school project or college project, can they come and just get materials, and are the materials free if they don't, if they're in the neighborhood, don't want to go to the website, can they stop by your office or they need an appointment?
If they want to like have a one-on-one with someone and have more discussion, they would need to have an appointment. But if they're just stopping in to get printed material, when they walk in the door, there's a table right in our entryway that's has full of information on other things that's going on within the area, on various topics as it relates to job openings, scholarships, where you can go for testing for COVID, for other types of things. So they can come in and help themselves to whatever they have. But if they need to speak to someone one-on-one specifically, then they would need to call ahead, because you want to make sure that person is available, they're in the building, or they're not already have a prior engagement.
Mm-hmm. So they could possibly interview someone with permission from yourself, but they could possibly interview someone from your staff the way I'm interviewing you as we speak.
Right, absolutely. So like I said, if they want to call or if they want to stop in, or like I said, if you go to that website, yourbodyfirst.org, you can, just send out a message and say, can someone give me a call back? I have a question about this or anything like that. And like I said, the printed material is accessible, it's free. You don't need an appointment. Just stop in the 1313 Main Street, corner Main and Riley. We use the rear door entrance. Just use the ring doorbell. Say, I'm just here to get some information. Can I come in and just take some of your pamphlets? They'll let you in.
Oh, great. And I also want to say, and I just it just dawned upon me, many people have many organizations have summer programs. And you may want to have for the older camp, for that older camper, meaning, maybe the teenager, share you're available to speak during summer camps, correct?
Yes. So our educator is on staff year round. So when the school is out for the summer sessions, we are still available and looking for places to speak, to do tabling, to do other events. I know for Juneteenth, Kaleida has a tent for a pavilion. There's other activities that happen, take it to the streets, whatever is out there. If we can be a part of it, we definitely want to have our literature or body out there to provide information on our services.
And it sounds like your department works on weekends.
Yes, weekends and some late evenings, depending on the sponsor. So if they meet, and it's a youth group and they meet after school, yes, we'll go. I know some of the high schools have the academies, and those are usually on weekends, one weekend or every other weekend. We make ourselves available. So like I said, we are, the educator is flexible in their schedule that they will accommodate whatever sponsor meeting time is required.
Okay. And then we have a few minutes left. Anything you want to cover that I haven't asked, we haven't discussed?
Just that we, our medical services, we're primarily screening for, we do breast and pelvic examinations. We do testing.
Very important, very important.
Yes, testing and treatment for sexually transmitted infection. We also have our birth control supplies on site. So you're not required to go to a pharmacy or to an outside facility. We do have medication and methods of birth control on site. We do other lab tests. We're doing vitals. You're checking your blood pressure, your height and your weight, your your analysis. We offer the counseling as stated with the providers. So they want to get a complete understanding because you're a full person. So everything needs to be comprehensive. Yes, you're coming in for one part of your anatomy, but you're a whole person. And so they engage you in conversations about, do you feel safe at home? Are you being coerced? Are you, in a healthy relationship? So all those type of things do deter and play a part in the person's decision to utilize effective methods of birth control. So all those things are discussed.
Mm-hmm. And I just want to say before we have to leave, but I just want to say that your staff has always been, I would say for nearly 50 years, cultural competent in terms of understanding needs of all communities. You've always had diversity within your staff that looks like the Buffalo community, not, any one segment, but like the Buffalo community. And I just want to say that family planning has always practiced that. Am I correct in saying that?
Absolutely. Absolutely. So, we do not discriminate based on race, color, religion, sex, national orientation, disability, sexual orientation, gender identity or expression, physical appearance, or their ability to pay, or their age. So it doesn't matter. You walk in this door, we want to see you. We want to help you as best as we can. If we can't offer the service that you're seeking, we are happy to be an active and effective referral to a facility or department or service that can meet your needs.
And Sherry, on that note, I'm going to say thank you because that was an excellent closing. Thank you so much.
You are welcome.
I have to incorporate some of that because you covered it all. And I'm just so glad to say, in the world of health equity and such that not you, but family planning for Kaleida, I'm going to say we've always been there. We've always met all of those needs. And I want to thank you as a manager. I want to thank you for being there most of your career here at Kaleida Health. And I just want to say thank you for being our guest for today.
Well, thank you for the invitation and the opportunity to talk about our department. I'm excited about it. We're looking forward to the new year, new opportunities, new growth. And we just want to keep pushing. We may not get another 50 years, but we'll take whatever we can get.
That's right. Woo-hoo. All righty. Well, I want to thank our listeners for joining us today for our program, Great Lakes Health Radio with Kaleida Health. And next Saturday, you'll hear from my esteemed colleague, Cindy Bass, the one and only Cindy Bass from Erie County Medical Center, ECMC. In 2 weeks, God be willing, you will hear from me, Francesca Messiah, Manager for Community Relations for the Kaleida Health Foundation. Be safe, drink lots of water. It's good for you. Take care. Bye-bye.